Hi, I am so delighted to meet you in the program of Horse and Heart News. Yesterday, 57 years old female was admitted with the complaints of sudden onset of dyspnea. When we received her, we found that her lung was flooded with coarse crepitations, obviously suggestive of acute pulmonary edema. Classically, her apical impulse was down and out. So, we were able to assume that her LV function might have come down very drastically. So, she was subjected to echo, which revealed her LV function was only 23%. Then, how will you manage in this patient? So, any patient who is considered to have heart failure, so three aspects to be addressed. The first most important is you have to improve the heart function. So there is no dispute on that. Okay. So you have to improve the heart function. But what is the most important responsibility of heart is to receive the venous blood from the periphery. Then it pumps the blood to the lung where it is oxygenated. So everybody is aware of this. So apart from improving the heart function, so our responsibility is to decrease the venous return from the periphery. That will give much respite to the failing heart. So apart from improving the heart function, the first most important task would be we have to dilate the veins. So what happened? The venous pooling occurs, or otherwise the venous return is markedly decreased. Hence, heart is relieved from the stress. So what are the drugs that would be very helpful in dilating the veins? The first most important is injection furosemide. So we all know that the furosemide acts on the kidney, especially on the thick ascending limb of loop of Henle, so where it causes diuresis. Interestingly, before it acts on the kidney, it dilates the vein when it is given in IV form. It dilates the vein by which venous pooling occurs. So venous return drastically comes down. So heart is getting much relief from the venous return. This one type of treatment. So you have to dilate the vein. Is there any other drugs that can dilate the vein? Yes, of course. You have morphine, which is considered the most powerful venodilator. But one biggest disadvantage would be when patient comes to an peripheral setup where your ventilatory support may be lacking. So at that time when you give morphine, yes, of course it will dilate your vein enormously. So venous pooling occurs, heart will be relieved. But the most important is it may produce respiratory depression. So before you give morphine, make sure that you have ventilatory support. Then apart from that, you can give NTG also, nitroglycerin. Nitroglycerin can dilate veins, but since nitroglycerin acts on the arteries as well, it is capable of reducing your blood pressure. So when somebody presents with 110 mmHg, at that time, if you give nitroglycerin, it has the potency to reduce BP suddenly. So when BP is not favorable and when you don't have respiratory support, then probably your administration of NTG and morphine is much questionable. So at that time, so injection furosemide would be very useful. So these are the three drugs that can dilate your veins. One, injection furosemide, and second, injection morphine, and injection nitroglycerin. Then, now you have dilated the veins. Now you have to improve the heart. Okay, improve the heart function. So what are the drugs that can improve the contractility of the heart? You have digoxin, yes, but digoxin not only enhances the contractility of the heart, it can reduce the atrial conduction to the ventricles also. So it would be very useful in the case of heart failure associated with atrial fibrillation. So otherwise, we are always not inclining towards administration of injection digoxin. Then what about dobutamine? Yes, injection dobutamine can be given. Injection dobutamine can enhance cardiac contractility, but make sure that the baseline blood pressure is at least 80. When you have lower blood pressure, if you give dobutamine, further dip in BP will occur. So you should be very mindful about blood pressure while you are trying to administer injection dobutamine. And you can give levosimendan. Definitely it will be useful. It is a calcium channel sensitizer. So definitely it will enhance your cardiac contractility. The levosimendan not only enhances your cardiac contractility, it has triple actions. One is increasing the cardiac contractility. It can dilate vein to some extent. It can dilate your arteries also. So it has triple action. Then you have to focus on arterial resistance. So it is easily assumed that the failing heart cannot act against the arterial resistance. So when you have good amount of arterial resistance against a failing heart, then definitely failing heart will worsen further. So better to reduce the arterial resistance as well. As I told you earlier, NTG is capable of reducing the arterial resistance, but NTG requires at least good amount of blood pressure. So when somebody presents with blood pressure around 190, 200 with acute pulmonary edema, then probably NTG would be more appropriate. So it not only addresses pulmonary edema with the help of venous dilatation, it can reduce blood pressure parallelly by dilating the arterioles, leading to decreased arteriolar resistance. So this is the way you can approach heart failure. So any heart failure, our task could be, you have to dilate the vein by which venous return should come down, and you have to enhance the cardiac contractility, and you have to dilate the arterioles. So the most important venous dilators include injection furosemide and injection morphine and injection NTG. The drugs that can increase your cardiac contractility would be injection levosimendan and injection dobutamine and injection digoxin. The most important arterial dilator would be injection NTG. I am so convinced that it would be much beneficial to you. Thank you.